And like Linda and I were just talking, it seems to be the three of us on most of these meetings. We may have some other people join in. I don't know if Diana or Sandra will join in as well. But thank you for being here. I apologize for the background noise. I was telling Linda our internet tower went completely down, and they said maybe tomorrow we might get out there. So the whole area is without. But again, these are the members that we have, but we've been a pretty, the three of us have been pretty strong on there. I had no internet access all day long, so I wasn't able to pull up anything else to use. I am sitting in the Starbucks with my daughter right on my hip, so hopefully she will keep quiet like she's supposed to. As you probably just heard her. I did pull up as well. This is the same we had the last time, kind of as our example, or one of the examples we've had before on the nomenclature, the descriptor, and the rationale. I was not able to be on the last meeting. We had a big award ceremony for one of the kids for the fair because they did fantastic. So our big overall group meeting. So Linda, thank you for representing in there. She was kind of filling me in on that. I haven't been able to listen into it yet since today was my day off to get all caught up. I'm living in the dark ages. I'll get to it though. So these are the descriptor sentences that we all came up and agreed upon, correct? Everybody's in agreement, and it sounds like the group really liked these.
We wrote, this is the descriptor, and then the nomenclature, I think, right, counseling. Well, okay, so counseling for the control and prevention of adverse health effects associated with high-risk substance. Okay, yes.
What was the take on that? Were they happy with that as well?
I think, you know, there weren't any suggestions. They were happy that we came up with this. The only other word we could put in there would be counseling and advising.
Okay.
For the control and prevention of adverse, yeah, but counseling, this is, you know, we said we used the main word, the primary word in the nomenclature that we want to get across. This is counseling by a healthcare provider about, okay. And then it's obviously gonna need an explanation, but that comes in the descriptor.
And there's our descriptor back again.
Mm-hmm. Yep.
And so I think we've all pretty well agreed that this is good. So now comes the part that we try to figure out the rationale. In my dark age home today with no internet access to look these up, I did have a few things that I did throw out there as well. And so let's pick apart and work on these together. But I did come with the purpose of counseling with high-risk associated with substance use that may lead to adverse health effects. The CDC has issued warnings against use of all vaping devices effective September 2019. This just came out this weekend, surrounding the risk of acute severe lung disease, negative long-term oral and systemic effects of electronic cigarette use is widening and forthcoming. U.S. Surgeon General has issued warnings regarding the epidemic of teen vaping, which is how they word it, and associated dangers. E-cigarette or vaping use is being investigated as a positive link with reports of seizures and linked to at least 5 deaths. As of last night, the CDC has said 5 deaths as of to date are the direct cause of vaping. That's where I put that.
Yep.
Opioid use and abuse is rising, with approximately 130 people in the U.S. killed each day by overdose, and that is according to the CDC as well. And then because we've listed alcoholism as well, I pulled in some of the statistics there. It is a risk factor, we know, for mouth and throat cancer, and it attributes to 88,000.
I just have a comment about using the word alcoholism, because there you're really talking about the disease of alcoholism. You know, it's an extreme disorder. It's addiction to alcohol. But a lot of people won't identify as alcoholics, but they might identify heavy users of
Should
alcohol.
we say alcohol use?
I think heavy alcohol use or something along those lines. Instead of calling it alcoholism, because it's like two separate problems. You can have heavy alcohol use without being an alcoholic. It's probably, you're either headed that direction, but I think it's a more palatable or easier for everyone, including the counselor, to talk about heavy use instead of alcoholism, because alcoholism, there's an implication that it's like a character defect, whereas lots and lots of people can relate to heavy use without calling themselves an alcoholic, which it's another problem that you have to get past. So I would describe that. Yep, heavy alcohol use is a risk factor. Yep, there you go.
Jill, what's your thoughts?
I agree with what she's saying.
No, that's a great suggestion. I agree. And where I pulled some of these from is looking just how on a previous one, how we had the different paragraphs breaking it down.
Right.
On the rationale, and that's part of what I pulled in there.
Yeah. So now, and what you could say to make that last bullet point, heavy alcohol use is a risk factor to mouth and throat cancer, according to the CDC, and maybe without making it a separate sentence, and contributes to 88,000 deaths each year in the U.S.
Okay.
It's a little bit longer sentence, but it's not exactly convoluted, and we haven't said alcoholism again.
I think that flows better. Absolutely.
Okay.
Absolutely.
Yeah. And I really like that you put in there 130 people in the U.S. Are killed. Do you want to say killed or die every day from opioid overdose or just overdose?
Yep.
Die each day. Yeah. Okay.
Overdose. And then do we need to elaborate on that, or are we just, because this is really where we present the facts of it, correct?
I think, well, the facts are important, extremely important, but then you want to say where you got them. And I would say right in each bullet point where you've got these facts.
I'm going to make myself a note here. So that way I will remember to add those in.
Yep.
Can I point out a spelling thing for you too quick?
Please do.
Okay. The sentence that says e-cigarette or vaping use should have if, and it should be is.
Oh, good catch.
Oh, okay.
Thank you.
Causative link with reports of seizures and linked to at least 5 deaths. Yeah.
Yep.
Okay, that's good.
What else should we add into this?
Oh, is this the only, what have you got on your next slide?
So my next slide is one that I had from before as well, that had just showing us our FDA statements, and we can include these in there as well.
Mm-hmm.
And this is just from the FDA acting commissioner.
Yeah.
And so this was in our last meeting as well. I had the opportunity to pull anything new in today.
So is there anywhere, you probably want to, I like the idea of using the ENDS acronym. That's good, but then when we do that, we'll have to spell it out first and then use ENDS after. But we'll do that when we do our final.
Correct.
How about this one in green? How about that statement? Where's that coming from?
That is also from the FDA acting commissioner.
Okay. Gotcha.
Sharpless.
That's the Sharpless.
Yep, that is also his, both of those are quotes directly from the FDA statement that are from him.
And what's so interesting is that even as we're writing these things, there are people hospitalized, young people hospitalized in comas, and possibly some more deaths that are going to occur between now and when we get the chance to talk about this at the CMC. So everything is going to be, this is brand new information that we did not have last year. We didn't have this.
Well, and I lectured on this at RDH Under One Roof, and even just as drastically as the research is coming out since that time, the 1st of August in a month, there's been so much more. I'm lecturing on the same subject again later this month, and it's going to be a day by day to pull in the most recent information up to that day. But I think that, well, let me ask both of you ladies, should we also pull into our thing that the state of Michigan has banned the sale of them, or is it Wisconsin?
Jamie, would it be okay if I shared my screen? Because I've got a couple of things I wanted to show you. I did look at, I wanted to start with calls to action.
I would do that. I just have to figure out how to make that happen.
I think I'm the one who does it. Let me see here. Ask if I can share my screen.
Change presenter.
Yeah.
Let's see if this works.
Okay, share now. All right, so a lot of times there's a little bit of a delay. So tell me when you can see my screen.
I see where it shows, yes, have a great meeting.
Okay. So I found this. What I did was I did a little search for calls to action. And, you know, because I figured, well, there's a bunch of things. So this one is from, I'm going to get rid of my little box here, it's from the FDA over here. And then understanding the dangers of teen internet use. It's a fairly long document. It's got some, what do you call those? Infographics, which are nice and material. Then we have, this one is the Surgeon General's report, e-cigarette use among youth and young adults, a report of the Surgeon General. And there's another call to action, which is in here. This call to action. Yeah, this is more writing, but I think there's some, call to action on youth and young adults. Anyway, I think using these authoritative resources are good. And I've got one from the American Dental Association.
Oh, I like that one right there too. I have not pulled up that one.
This one is Opioid Crisis, Delivering Straight Talk on Opioids from the American Association of Colleges of Pharmacy. And they talk, you know, about not just taking drugs, but also storing them and disposing of them and not sharing and being, you know, more conscientious about getting it out there, sparking conversations. Yeah, I just like these. Now here's one about methamphetamine, which is kind of receding, I think, but it's still very much a problem. So this one was published in the Drug and Alcohol Dependency Journal, and taken together the review, broad-based update on available literature, research, past 2 years, la 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 la. Anyway, we can cite these things. I think if we're going to mention methamphetamines in
we need to be able to.
We just want to cite some authoritative resources. Update on epidemiology, pharmacology, clinical phenomenology, and treatment literature. Again, I think these will help us, but the state of affairs is, I think, in the dental community, there are really only a handful of people who feel knowledgeable enough to tackle this issue. But if we start by having a code in our manual, and then we begin to educate ourselves about how to use that code, how to help our patients with these problems, that's going to be, it's a good place to start. And this is the one from the American Dental Association. I'll look at e-cigarettes. Now this was fairly short. It was published in March of 2019, and that was before the first death actually occurred. So they talk about, you know, your vaping device blowing up. They talk about getting addicted to nicotine and things like that. But anyway, so now I'm going to show you this, and I can send this along. This is a Word document what I did was I took all of those sources that I just cited with you, and I put them in this document, and I'll share.
Wonderful.
So potential authoritative resources to start here, and if we pick out phrases and just, again, statements from each of those calls to action or resources to help bolster, I don't think there's any question that we need to do something. So anyway, but getting a nice reference sheet. So this is the one about vaping of cannabis and nicotine. I thought was interesting. But the first one is from the American Dental Association. A look at e-cigarettes. That's just that one pager. This is a little bit longer document. This one is about methamphetamine. You stick to your stomach, and this is the conclusion. It's a fairly long conclusion with methamphetamine. Depending on where you live, it might be a very, active problem, but it seems like when people are going to the hospital and dying, and especially if it's in numbers, that's what gets your attention. This is one from the American College of Pharmacy, and then the CDC, Youth and Cigarettes. Let me change this. That was 5. Okay, so this is an expert. This is the full report here. Number 5 is the full Surgeon General's report. And number 6 is just the call to action, which is a part of that other one that I wanted to. And then this is kind of a, it's a teaching tool to use with teams. So I will send this to you. And, I think what we should do is just have some statements from each of these and pull our recommendation together.
Absolutely.
It's hard, but what is our rationale for having this? Is it ready? For having this submission? What do we think?
Well, that's where I go back to. I'm going to take that back there. So when we're looking at some of this, I was going with the rationale. So I think those are a good start. I think that maybe we should add something on methamphetamine as well, because we have it in this descriptor. Or should we not? And as well as a certain setting of cannabis.
I didn't quite understand what you said just then.
Sorry. Should we add something on a statement in the rationale as well on the methamphetamine as well as the cannabis, because we are listing them in our descriptor?
Well,
or
the main idea, the way I get it, is why are we writing a new code or recommending a new code be added to the CDT code manual? The answer is because there are numerous calls to action, and here they are. Here are the calls to action. Yes. That healthcare professionals must begin to actively
address it.
Yeah, we need to address it. We need to provide some services, which means counseling and advising and helping patients identify the problem. Don't look away. Don't pretend you don't see that. We have to do something, and having it in the code manual is going to be a necessary first step. People, dentists, hygienists, everybody on that team needs to learn more about what they can do and how to address the issue. If they don't know now, there needs to be other ways for them to learn about it. So it's a continuing education thing, but when we're talking about giving services to patients that there's a need for this, the need is absolutely crystal clear. People are going to come and sit in the chair, and we should talk to them about all the ways that these misuse or overuse of chemicals and vaping devices and all that kind of stuff can hurt them.
Absolutely.
So I had a doctor's appointment, and you know, they do my vitals and they check all the medicines that I've taken. They ask me about my smoking history and my alcohol use, and that kind of stuff. And I said, I think you should ask me about vaping too. And she gave me a look like, what? I said, you should ask me if I use vaping products. I don't smoke, but what if I, was using that? And she kind of said, yeah, we should really be asking about that. And I said, yeah. Well, here's the answer. No, I don't do that either. Anyway, but it's things like that. Add this to, like, again, now I'm going into the educating the healthcare providers. Add this to your health history taking. Talk about smoking and talk about vaping.
Absolutely. Absolutely. I was just asked by one of the publications to provide a statement because I've written articles on it, I've lectured on it, with everything new that's coming out just in the past week, saying, will you give us a statement on this and how it's related? So, I mean, it's definitely catching the eye of everybody.
Mm-hmm.
And I agree. I wholeheartedly think we need a code on that. And having that backing of the statements, the call to actions from the ADA, the CDC, the FDA, everything, all the above, is really, I think, is going to help push it through. Rationale-wise, when we look at this, is there anything else that you can see that we really need to add to it? Or changes, suggestions? Pick it apart. I'm definitely open to anything.
I gotta find that. Let's see. There we go. Okay, I'm not talking because I'm sending you that document.
No, you're great, and I appreciate that. Thank you so much.
Just in terms of a framework for why, I'd like to look at what was submitted last year.
Yes, and that's what I was trying to get this morning, but there we go.
You didn't get there?
I didn't get anything. I did. I didn't get squat.
Yeah.
And I live about 15 miles from going to Starbucks, so I wasn't going to run here multiple times.
Let me see if I can find it. Let's see, the Dropbox, right?
It should be in Dropbox.
It'll take me a minute to open this up.
And I know that because we tried to modify the smoking cessation code, the tobacco code, and that's what was shot down. And so I was hoping to get that rationale pulled back up. But I mean, in a year's time, it's changed so drastically. What we can provide is our study and our backing behind it too.
Yeah. I think the rationale that was used last time was just fine. All CDC work groups, 619. But I won't be able to open it. Oh, no, maybe I will. Okay, oops. No. Okay. I'm getting a warning like, oh, your computer or some computer didn't like it. and it had a serious problem, so you didn't want to open it. Yeah, these are vaping to Patty. These are old ones actually.
And so
they're just from this year, I should say.
Yes.
So not, well, no, I mean 2020.
Oh, okay.
You know what? I almost think it's not gonna matter, to be honest with you. There's so much energy behind this that our rationale is we need something in the CDT manual. It is correct. We should agree. It's correct not to do anything to the tobacco cessation counseling code. Leave that alone. That's a different issue. And now we're going to talk about all the other things and have a mechanism for dental providers to talk to their patients about this. Then the other thing that I'm going to do, I would love for us to. I've been waiting to have this meeting today before contacting Sharon Perlman, because she may have some suggestions. But could we schedule like a conference call, you think, sometime? She's in Illinois.
Absolutely.
Okay.
Can we do work? Both
No.
work Fridays?
I don't.
I don't either, and Fridays are almost the safest bet for me, just to guarantee that I won't have anything going. I also had reached out, finally tracked down Ann Petrell with the ADHA, and she is more than willing to help with anything we need. I did get the names for the AAPD as well, on who we should contact there to try to get the back in the American Academy of Pediatric Dentistry, because this is an epidemic among kids, among teens. I don't know if there's a coalition there, but it won't hurt to try to reach out and see what we're doing, because they've got a stance on it as well.
Right.
So that was also on my to-do list for today, so that will happen. I'm restored from the dark ages. So
Right.
that will also happen, and I'll reach out to them this week as well. But to see if we can get something there, and it really seems like we're kind of the core group here. So do Monday nights still work okay for both of you ladies? Is that still a good night? I know that's been our designated night.
And Mondays work well for me.
Yep, they normally do for me too.
If there was another night besides Monday, I would prefer it, but if that works for the two of you, then it works for me.
Okay. I know we're on all different time zones too, but
yeah. The time is okay. 8 o'clock is fine. I'm in Central.
Okay.
What time zone are you in, Jill?
I'm in Central as well.
Okay.
You are, okay.
Well, I'm on Pacific time, so.
Yeah.
Normally I can do this maybe an hour earlier. We just had stuff going today with kids, so that's why I had to do it a little bit later today as well. So maybe we can look to get this down if we kind of agree on the rationale, or we can go between the three of us and really get a couple more sentences added to that, and then schedule up a meeting with Dr. Perlman and see how we can go from there. But Fridays, if you can get it, Linda, Fridays usually are really, really good for me, with the exception of the 21st. I'll be traveling, but anything other than that is great.
Okay. So let's see. Yeah, Fridays. Either you said the 20th.
Maybe it's the 20th. It's the 20th, 21st, something, whatever that Friday is. The only one that is out.
That's not good. Okay. All right. And would this Friday, if for some miracle, oh my goodness, we could meet on Friday the 13th with Dr. Perlman. That would be okay?
I believe so. Let me pull my calendar real quick.
Otherwise, it would be the 27th. But that's really, yeah.
This Friday, if we can make it work, I'm great. Absolutely great with that. And hopefully we can get some response and a little bit more from some of the other places as well. And how about, just let me know, and then I will also shoot an email to you both if I get anything different. And maybe we can add to these sentences or this rationale a little bit and share amongst us ahead of time.
And what about the time on Friday? What should I suggest?
My kids, I'm Pacific time, they're out the door by 7:30, so 7:30 Pacific time, so anything after that's great. I have no restrictions on Friday whatsoever, other than that.
Okay. I'm trying to remember how many time zones that is away.
I'm
we've
two.
Got Mountain, Central, Central, and then Mountain and Pacific.
Correct.
Right?
Yep.
Yeah. Okay, so you're like 3 hours.
I'm 2 hours. I'm 2 hours behind Central.
2 hours behind
Yeah.
Central. Okay. All right. Well, I'll see what I can do, and we haven't formulated the entire rationale just yet, but yeah.
I can definitely make it a priority to get working on it this week as well.
Well, we've got a good start. I shouldn't say that. You have a very, very good start, but I really want to like nail that down. Like we are
Absolutely.
responding. We're responding to the calls to action, numerous calls to action about safe and unsafe use of drugs and chemicals and devices. We're trying to make a code so that we can begin to educate our healthcare providers, and then we can in turn begin patients with this. So.
Absolutely.
Okay.
So
I mean, I think it should be a slam dunk. I don't know. Sharon Perlman said something like that. She said, "I'm determined this is going to happen this year," and so we'll see.
well, I sure hope we can make it, and I couldn't do it without either of you by any means. So you guys have been awesome. Even if there is only 3 of us who usually show up.
Well, you know, that's the way it goes.
And again, these are just some of this. This is just another study I had in the link with periodontal disease from before. I think I had this last one as well. And then another one, the inflammatory response. And this is just based off the conclusion. And this came out of the University of Rochester. So it also gives that oral link to it too, not just looking at the systemic part. I think, Jill, we provided this last time to, or I don't know who did. Maybe I found it.
There you go.
It's so far behind me. But the information for health providers, and they also provide a link that includes questionnaires that you can question your patients with, and you can help provide that support. So those are out there as well. Like I said, we're going to also look at the coalitions. We've got links to the AAPHD and AAPD, and then Ambitrel at the ADHA. Again, I'm going to catch up with her and see if we can't get their stance on it or some of their backing as well, or suggestions to help me.
Even if it was just a handoff, just like a handoff, somebody's, Ambitrel could identify Jamie Collins and Jill and Linda as this small team of hygienists who are working on a submission, and they would love your feedback, anything like that. I mean, ADHA doesn't need to direct it or anything like that, but I mean, I feel pretty good about the AAPHD one. I felt like she was very receptive and even grateful. So I'd be kind of curious about what she's working on. And, here's the only concern I have, and it's not a big concern. If she's already done work along these same lines and wants to submit something or have something submitted by her organization, Dr. Perlman, and then take 100% credit for it, like, that's cool. You know what I mean? If it works, we can just support it. We can say, this is, love what you did. Sounds great. Maybe I don't know. We'll see. I think what we've done is very good. And especially if we can bolster it by giving really good references and good rationale for why we're doing this. It seems kind of extremely obvious why. We should have to do a lot more than look at all these kids, these young people who are dying. We don't know very much about it, and so we have to be ready.
Well, I even had a mom on my son's football team this week. I'm sitting there, and so my kids know my stance on this very strongly. Yeah. And my daughter's pointing out, she's vaping amongst the moms. And one of them says, "Well, I don't smoke."
Yeah, they don't.
And that's the logic of people have, is I don't smoke. Okay, no, but you're doing this, which isn't healthy either.
Right.
But,
And they have been told by the manufacturers that it's safer, and but now there's plenty of evidence that's coming down the pike. I'm pretty sure there's going to be another one, in a few days. There's a lot of people hospitalized.
Absolutely.
I think I read an article today that there were 450 cases of hospitalized people with unusual lung presentations.
Yep.
And pneumonias that they haven't quite figured out. There's no logic to it, and then they're going, oh wait, let's ask about vaping. And sure enough, oh yes, well, what were you vaping? Were you vaping THC or nicotine? What was in there? A lot of kids don't even know that what they're getting is nicotine. They have no idea.
Or they think if it's nicotine free, it's completely safe. Well, it's not.
Right.
They're finding that some of these, I did read one thing last week that they're starting to link some of them to the vitamin E oil and the THC suspension as being what's causing it. I've also read that it's also not, some of them are not that. It's multiple manufacturers, multiple across the board, the flavoring, the diacetyl, the acrolein, everything else that's in them that, may be safe for human consumption and tested that way, but it's not when it's heated and inhaled for the lungs. You can eat it and be fine, but it's when it's inhaled in that form.
Yeah.
And as we're sitting here in Starbucks, my daughter's next to me pointing out about every third car in the drive-thru that somebody's vaping at as we're staring right out the window.
Well, tell her she can be an advocate for health.
Yes. They say you're a good advocate.
Good for her. How old is your daughter?
She's 14.
14. Hi. What's her name?
Julie.
Hi.
Oh, she's.
Hi. How are you?
Yeah, we're all saying, how are you? She said her piece, apparently.
Yeah, okay. Mama was talking about you.
She did good. She did good. She's been bribed with treats after to sit here and hang out with me while we do this.
Very nice.
So, again, I can't thank you ladies enough. You've been great to work on this with. Definitely a great insight and leadership helping me get through this as well as we do it all together. And let's touch base. I'll just keep an eye out for email, or hopefully I have it by then.
Right. An email invitation. And I don't know how you feel about this, but I would just as soon give Sharon Perlman what we have, even if it's not in its completed form, something for her to look at, and then talk about when we get together, and invite her to a Zoom meeting of some kind. If we can get it as early as this Friday, that'd be awesome. I'll try to pick a time in the middle of the day-ish, so that it's not too early for you.
Well, and we're early risers too. So if it works best for her, I'm great with that.
All right.
But yeah, my daughter has to be on the bus at 6:30 in the morning, so we're forced to be.
Wow.
Yeah, it's early, and so like I said, if she's limited to mornings, so be it. Run with it. I think it's more important to get the meeting than the beauty sleep. So,
all right, I'll see what I can do.
Wonderful. Thank you both so much.
All right, thank you.
All right.
Thank you both.
Have a good night. Hope your internet comes back.
I tell you, he moved me to the sticks, and now we're stuck up there. So
I know.
it's really slow. You can't do two things at once, but usually it'll at least work for me.
Thank you, Jen.
All right, ladies, have a good night.
Thank you, Jamie. Good night.
Good night.